There's also research that has shown that early interventions using multiple different types of approaches can actually lead to success when addressing complications and compliance with these patients in this population in particular. So what defines compliance? Well, we have several ways that we would want to define compliance. However, the Centers for Medicaid and Medicare Services actually defines it for us. We have to tell the patients that they have to use the device for at least 4 hours each night for greater than 70% of nights to actually be defined as compliant. When I have patients come into my clinic, I tell them ideally I would like for them to use the machine every night during all hours of sleep, including naps. However, that isn't realistic for many of my patients. So if I can at least get them to use the CMS standards of compliance, I know that I'm at least going to get them feeling somewhat better and get their risk of any comorbid conditions to go down. Many private pay insurances have actually started to follow suit. So CMS was the first group to start requiring compliance, and then the other groups started to follow that as well. And now what we're finding is that many patients are having to initiate the compliance, and if they don't reach compliance status, they actually may have to return the device or pay out of pocket for their CPAP device. We find that if they are unable to reach compliance status, they are finding that they're going to have to pay out of pocket for the CPAP, or they have to return the device. So either they don't return to clinic to go ahead and restart therapy, or they find that it's cumbersome for them to have to go through the process of actually restarting the procedure to get a CPAP machine down the road.